Good afternoon. It is our pleasure to have you with us this evening as we talk about creating community connections. This forum on this evening is sponsored by Oak Grove United Methodist Church and the South Carolina Christian Action Council. I am Dr. Deneen Fleming, and I will be your moderator for this evening. We will go through the program as outlined. You will have an opportunity, whether it's on this virtual format, whether it's in YouTube, whether it's on Facebook, to be able to ask questions, to get your questions answered, to listen, to go back and look at it. But this information is for you. And so we have a team of expert panelists who will share information with you. And we look forward to being with you this evening and thinking about, as we go over the purpose, as we think about why we are here this evening, why this is a outline that we are doing. It is to engage the community. That will be you, that will be me, that will be everyone who is able to listen, see, and or hear in acquiring information about COVID-19 and what we call healthy living post-COVID. But let me give a little bit of information about this post-COVID. It doesn't matter what our belief may be, because there are some people who believe we may never be post-COVID, that it will be around just like the flu. There are people who believe COVID may go away or it's gone away. Whatever it may be, we want to at least be able to think of ways in many different capacities, in diverse capacities, how we are able to survive together during everything that's going on, this during, after, with a pandemic, and be able to continue to flourish as individuals, as humanity, as communities that work together. So with that being said, we want to welcome you this evening. We are going to engage together on behalf of the pastor of the Dorchester Parish, Reverend Laurie Tomlin, who is on, and his support. Thank you. As well as Dr. Latoya Glenn, who is behind the scenes today as our IT coordinator making all of this work. We want to make sure we give the credit where it is due and thank both of them, not only for their support this evening, but continuous support as we are working to make sure the information that's provided to, with, and for the community is accurate, timely, but also something that is for everybody. So thank you to both of you for your continuous support. Now, virtual decorum. There's only a few things and rules we want to make sure we follow together as we are working. The first is respect the opinions of others, whether it's in the chat, no matter where it is. We don't have to agree, but what we want to do is be respectful and mindful that everybody is different. So respecting the opinions of others. Our second is going to be, if you have a question, you want to place it in the chat. Online on the Dorchester Parish page, there was an electronic form that will be in the comment section or the chat, that if you have questions, or if you just type it in, whatever it may be, to make sure we are able to address those. And when you're able to come on, if you would, anybody who's not speaking, make sure your device is muted so that we will be able to continue and hear each other as we go through this evening. Now, it is my distinct honor and pleasure to be able to introduce our distinguished guest and panelists this evening. And so I want to start with Dr. Sarissa Hughey. Dr. Hughey is a psychiatric mental health nurse practitioner. Say that again. Author, speaker, educator, organizational consultant, and mental health advocate with a wealth of knowledge and experience in diagnosing and treating a wide variety of mental health and psychiatric conditions in patients of all ages. She is most passionate about trauma-informed care, emotional wellness, reducing mental health disparities, and creating a culture of mental health awareness and sensitivity. She works diligently to help bridge the gap between organizations and mental health. She is the author of Cultivating and Creating Healthy Mind Spaces. As you see in her background, is MYND Spaces, 9 Strategies to Emotional Wellness and Personal Growth, and the founder and CEO of Mindspace Mental Health Education and Consulting, LLC. Mindspace provides mental health workshops, training, and consulting for government agencies, corporations, universities, K-12 schools, community-based programs, faith communities, nonprofit organizations, and mental health professionals. That's for everybody out there, anybody listening. Using her professional training and experiences, she advocates for a holistic biopsychosocial, thank you, approach to mental health, which requires that we compassionately consider our full selves, the mind, the body, the spirit, and the environments in which we live, work, and play. Dr. Hughley was recently named the Harbor Club Future Leaders Class of 2022. She was named one among them. Congratulations. She was also awarded Charleston Regional Business Journal's 40 Under 40. And she is the first, let me say that again, she is the first African-American female psychiatric nurse practitioner to launch her own practice in the city of Charleston, Dr. Hughley. Next, we have Gary Bonesteel. Gary is the Community Relations Coordinator for Absolute Total Care. I always want to put health in there, Gary. One of Medicaid plans in South Carolina. He has been doing community outreach for over 7 years and works in 8 counties throughout the Lowcountry. His goal when doing outreach is that people better understand the resources available to them and how to best access them. We appreciate you being with us tonight, Mr. Bonesteel. Ebony Summers Fogel. Ebony is a Somerville native who earned her bachelor's in English with a minor in secondary education from the College of Charleston. She went back to teach high school at her alma mater, Somerville High School. Go Green Waves. She earned a master's degree from Columbia College and an EDS from Capella University. She served as a high school English teacher for 10 years, a district interventionist for 8 years, and has served as a high school assistant principal for 5 years at Ashley Ridge High School. She's been married for 18 years and is a mother of 4, including a bonus son and the bonus grandmother of 2. Ebony Summers Fogel, thank you for being with us this evening as educator, as well as with Lambda Nu Zeta, chapter of Zeta Phi Beta Sorority Incorporated, and who will be joining us in a bit, who was called because she is also a practicing physician. And of course, it would be that things come up right when it's time to begin. It will be Dr. Ashley Primus. I do want to go ahead and introduce her so when she joins. Dr. Primus is a board-certified internal medicine physician residing in Columbia, South Carolina. She is originally from the Texas community of St. George, South Carolina. She is the daughter of the late Reverend Robert and Pearline Jennings Primus. She is a 2002 Woodland High School graduate. She furthered her education at Xavier University of Louisiana, graduating with honors with a BS in biology. After undergraduate studies, she attended medical school at the Medical University of South Carolina, graduating with a Doctor of Medicine degree in 2011. She also obtained a Master of Healthcare Administration degree from the University of South Carolina. Dr. Primus is currently practicing hospital medicine with Prisma Health in Columbia, South Carolina. She is also licensed in the states of New York and Florida. At Prisma Health, she is actively involved in the processes of improving patient care. She serves on the Clinical Care Guidelines Reference Committee and the Harms Elimination Committee. She has been involved in research and is a published author with works on medical and biological biodiversity literature. She is a member of several professional organizations, such as the American College of Physicians, South Carolina College of Physicians, the American College of Healthcare Executives, and she is also a member of the illustrious Delta Sigma Theta Sorority Incorporated. Outside of work, she enjoys traveling, networking, sporting events, health fairs, motorcycles, and combating healthcare disparities. So when she is able to join us, Dr. Ashley Primus. So this evening, we are going to begin with an opening from each of the panelists, and we can go in the order if that works for each of you, that I introduce you. So Dr. Hugie, Mr. Bonesteel, Mrs. Summersfogel, and then Dr. Primus when she's able to join us. Just your opening statement as you think about what the topic is and anything you would want the guests to know just as openers before we get into questions or anything else. And thank you each again for being with us this evening.
Thank you, Dr. Fleming, for such a warm introduction. It's truly my privilege and honor to spend this time with you all this evening. And as she stated, I am certainly passionate about reducing mental health disparities and providing mental health education to community organizations. I believe it's necessary for us to consider our community connections as we re-engage into society. And certainly we've seen an exacerbation of mental health conditions and concerns. So I think this event is certainly timely, and I'm excited to be able to share with you all.
Thank you. We will go to Mr. Bonesteel.
I am thrilled to be here to really just talk about and provide information about, what the post-COVID landscape can mean to people, how we can access community resources, and things that are already available to people to help kind of fill in the gaps when people do get sick and issues come up, and how we can better also use our health coverage to access care, because as it was stated in the beginning, I think a lot of people have varying definitions of post-COVID and how COVID affects them individually and their family. So I think it'll be a good discussion tonight.
Thank you. And Ms. Summersfogel, who is able to join back in. Let me just say, it is so interesting being able to see Mr. Bonesteel's background because it's getting dark where I am. Ms. Summersfogel was kicked out because it's storming. And so all the differences to show just the diversity in where we may be sitting. So Ms. Summersfogel, welcome.
Thank you. Good evening. And I apologize that it's dark in my house, but I've lost power, so it's just the light from the computer. Thank you for having me this evening. None of us could have imagined 2 years ago how the world shutting down would affect our students and their families during and after COVID. While it might seem like kids would be glad that there was no school, and some of them were, it affected kids and students and parents and educators in ways that none of us could have imagined. Many of our students experienced more mental health concerns, depression, and anxiety. Some of them lost the motivation to do well. Some have fallen behind in their classes and have learning gaps that need to be addressed. In addition, many schools are facing the issue of more student conflicts, and some teachers have had to redo their lesson plans and rethink the way they've been teaching to make it more modern and engaging for students. So not all of the changes are bad, like that one. Until recently, traditional education hadn't changed much in the last century, despite the way that the world has changed. But now we realize that we have to move forward to meet the needs of our students and families. There are some disparities, like not all students having access to Wi-Fi, that had to be realized and addressed. So we still have a lot more to learn, but we're on our way. Community, parents, guardians, educators all have to work together to give our students what they need. Thank you.
Thank you. So I want to start with a question, one of the questions, and they'll go to Dr. Hugie first. And it's going to go a little like this, Dr. Hugie. In terms of COVID patients, especially at the height of the pandemic, has there been an increase of diagnosed anxiety and depression due to feelings of isolation, residual health challenges, or even work-related concerns?
Absolutely, Denise. I think that's Dr. Fleming. I think that's a really great question. in that we did see a increase in mental health concerns as a result of the pandemic. And I think that's largely because we were made for community, right? We were made to be in relationships. And so what we have seen is that not only have we seen newly diagnosed conditions as it relates to depression and anxiety from the lack of social connectedness, we've also seen people who struggle with substance use disorders, people who struggle with mental health concerns. We've seen those conditions worsened, a lot like Ms. Fogel was talking about earlier, as she was saying, a lot of what we already knew to be the case, the pandemic has really caused us to rise above and understand that we need to adapt and change. It's really also brought a lot of things to the surface, really, that may have been the disparities that already were present. We saw the widening of the gap in terms of mental health during the pandemic.
Thank you. Wow. Widening. Mr. Bonesteel, the next one is going to be for you. In your opinion, and we know this is your opinion, what does the future of the COVID pandemic look like?
So I think that, the further and further out we get, it's going to get to more individual solutions, individual responsibility for what is really a global and systemic issue. I think we keep seeing this, represented with the mask mandates and how that's been dropped, reporting, the quarantine amount of times. And, I think that it is unfortunate because, I am a father of 3 kids, and 2 of them are going, one starting kindergarten, the other's going into 4th grade, and so we're really waiting for, when we get sick, trying to talk to our kids specifically about, wearing the masks. We have been really good, since the start of the pandemic, and only recently, a month and a half ago, did one of our kids bring home COVID, and then it went through the house, and we are thankful that we are in a position of some privilege where we were able to stay home and quarantine the kids with little to no impact to our ability to work, to our ability to, take care of the children. There weren't, significant issues that we had to overcome. And again, we are fortunate in that respect. And not everybody is. And when there are no systems of help or whatnot, as those things keep falling away as we get further and further out, it is up to the individual that, to take responsibility, which is a double-edged sword.
Wow. Thank you. Very personal. Thank you. Mrs. Summers Fogel, and Deneen is fine. I heard Dr. Hughes say earlier when you went back, it's fine, Deneen. What resources are available for families who need assistance, Ms. Summers Fogel?
There are a lot of community organizations that are out there that provide resources for parents and students. It just kind of depends on what the family needs. So if parents are searching for jobs, then there's SC Works or Job Corps. If they need assistance with funds, then there's the Charleston County Human Services Commission or Palmetto CAP. If they need food banks, there's the Low Country Food Bank, and there are several giveaways from like the Community Resource Center. So it just kind of depends on what the families need. There are services for abuse and addiction. And I have a list that I've compiled for are families at my school that I can share via email. If anyone wants that from me, it has the phone numbers and the websites for those different organizations, and I'll be glad to share those.
Thank you. And we can post those because I know another is South Carolina State, and it helps with, depending on what county you're in, with rental assistance. So before I even go to the next sets of questions, for anyone, for any of the panelists, is there something that you feel you want to add to any of the questions that I asked in the first round? I want to give you that opportunity before going to another set of questions.
Yeah, I do. To kind of continue on with the resources piece, I work for Absolute Total Care, which is one of the Medicaid plans. And one thing that folks may not know is right now Medicaid is frozen. And what that means is everybody's getting on to Medicaid, nobody's getting off. And what that means is there are usually so for example, if a child ages out of Medicaid, turns 18, they would lose that Medicaid coverage. They could reapply elsewhere, reapply and try and get in under a different category. But right now, that child, if they turned 18 at the beginning of the pandemic, then turned 19, turned 20, would still have full Medicaid coverage. There are, expectant women who normally after giving birth to their child would have 60 days left of Medicaid coverage. And then they would either need to reapply and see if they qualify for the parent caregiver status, or would have to find coverage elsewhere or not have coverage. And so again, they will continue to have full coverage. And we do not know when that freeze will lift. There is talk of the end of the month. There's talk of October. There is talk of the end of the year. We will not find out in terms of us on Medicaid. And I think I'm just getting that storm you were talking about. We will not find out until it happens, unfortunately. And then everyone is going to have to go through the renewal process and all that. And so I know Medicaid and all of that sends a lot of mail, but we are trying to make people aware that, to go through the mail, make sure your information is up to date. So that way you at least have something specific that you're looking for in terms of the update. So you know how long you have full health coverage for that you can continue to utilize until that freeze lifts.
Thank you. Dr. Hugie, I see your mouth moving, right? You coming in?
Yes, I am coming in. So I just wanted to add really, just from a mental health perspective, I don't know that we know the full implications of what the pandemic has caused. But I do want to talk about even some positive things that have come out of pandemic, because yes, we are forever changed and we mourn the loss of so many things and the loss of life as we know it. But what I've seen is so many more people being proactive about their mental health and coming into treatment. I see a lot of 20s, and this generation is really serious about healing from past traumas and really understanding the importance of their mental health. And I think also we have a greater appreciation for our relationships. And so then we become more intentional about how we engage in that process. And so although we've lost so many things, I've also seen a lot of positive things that have come out of the pandemic as well. Children whose parents may not have sought treatment in terms of diagnosis of either learning disabilities that have now become evident because of the pandemic are now seeking treatment and seeking those accommodations. So I just kind of want to shed a little light on the positive things that have come out of it as well.
Thank you. Because it's not often we hear any positives, as if everything was bad. versus that there are some things that were put into place because of, and even those, I think I sometimes say it's a matter of me having privilege. I didn't think about insurance and those who may have lost it, but was able to maintain and keep it, or that now more people are becoming aware, or as Ebony said, that now, there's a list of all the help that's available that so many people may not have known before then. So thank you for giving that lens also. So I'm going to go from Ebony. I'm going to start with you this time. Let's do another question. How can a parent or guardian help get their student back on track if they have fallen behind?
And a lot of that is going to be dependent on the grade level of the student and the types of resources that they need. But the first step is always going to be to contact the school and see what they have available. I can tell you, for example, that my school, we have Saturday school once a month. We have evening school every week to help students and give them tutoring, or if they're behind on credits, they can take classes online and catch up to their right class. There are groups that offer tutoring. There are teachers that offer tutoring during the school day. So there are many, many resources out there that can help students who've fallen behind. But the first step is always going to be contacting your child's specific school. And if they don't have what your child needs, then talk to people in your community, talk to other educators that you know, and see what resources they know of that are out there, because there are plenty.
Thank you. And that's good to know. Gary, what do you recommend people do in order to keep themselves and their loved ones safe from COVID?
Again, it's all individual, kind of responsibility choice thing. A lot of it comes down to a certain level of assessed risk. If you are without children, you're in work from home or only go to the office, your risk may be lower than somebody like myself who has 3 kids and, some in school, some in daycare, and, the pools where that kind of stuff can pop up are bigger. But, again, we made the choice. All our kids are vaccinated. Everyone has their booster shots. My wife and I, and even the kids, we still put our masks on, going into, grocery shop, Target, Walmart, all of those places still wearing the masks. We have the masks in the car, trying to be up to date as you can about community transition, so that way, if community spread is high in your area at this time, maybe you don't go out to eat, this week. It is a lot of, what is comfortable. And I think that, my wife is a lot more anxious about this stuff than I am, and a lot more tuned into it. So thankfully for her, it's probably the reason I didn't get COVID, for 2.5 years almost, and that's not because I wouldn't have been wearing a mask or wouldn't have been vaccinated, but again, just not as tuned in to that kind of stuff and may have made different choices. Also, if you have people in your lives that are immunocompromised or, have, special needs that make them more at risk for that stuff, that's also going to change individual calculus of who you are seeing, how you are doing, things. And yeah, and it's about being mindful of how many points of contact you are going to be having with, people who may not be as stringent with things as you are, and that to me is really the way that unfortunately we have to go is, what are you, knowing your values and knowing where your sticking points are and making decisions based on that to really navigate things.
Thank you. Thank you. Oh, the personals. That's something else. Wow. So, Dr. Hugie, I'm sorry, Gary, you said that and it's got me thinking. As we are entering this post-COVID era, notice I put the quotes up, right? Air quotes. What are some ways we can help mitigate the mental health effects? And I also love that you put, it's almost like the things that we don't want to talk about, but now hopefully people are beginning to talk about it even more because you're seeing, and we want others to also. So, what are some ways that we can mitigate the mental health effects?
Sure. And I'm happy to answer that question because I think it's a good way to kind of focus more on the solutions. Like, what is the path forward, right? We have no ability to change what has happened over the past few years, but certainly we have everything to do and say about how we proceed. And so, one of the things that I would say as it relates to people's mental health is to be proactive about it. And so, oftentimes, we experience things and then we're trying to do damage control and being reactive, but really recognizing that every moment of the day is an opportunity for us to take care of ourselves. And that is from the boundaries we set to the water that we drink to the relationships that we engage in. And so, really creating that holistic approach to your mental health, right? So that it's not reactive, it's quite proactive. And I think we've had a lot of time to spend with ourselves and getting to know ourselves. And so understand what we can tolerate, how we go about our relationships, what we can engage in is critically important. And then staying connected, right? Being very intentional about the people that we spend our time with when we're able to spend our time with. I feel like all of us are kind of, have some anxieties, like we're looking out of the window or we're trying to stick our toe in the water to get used to being around people. And I must admit, I'm having to get used to that, right? Because we've all gotten kind of comfortable in our little boxes and spending time with ourselves. I did a workshop recently where before everybody was working in person, and this was the first time these individuals had seen each other in person for a few years. And when we were talking about creating a culture of safety within that organization, everybody was saying, can we have the option to still work from home? So we want to stay comfortable. It's like, no, this is our job is in person. And so how do we re-engage the world and do it in a way that is safe and pace ourselves, but it's necessary, and that we don't stay stuck in our little boxes anymore, and that we understand the importance of community. And I think that's important, checking on our neighbors and friends and just re-engaging.
Thank you. Dr. Primus has joined us. And I always say when you have the practicing folks who aren't really practicing because they're doing the work, like Dr. Hugie and Dr. Miss, welcome, Dr. Primus. A question for you. You were quite active and vocal in the community and on social media during the height of COVID, providing factual information to all members of the community, but especially working with rural and marginalized communities. Can you tell us why and what your message is today, since some people believe we are post-COVID? Oh, she got disconnected. I'm so sorry, y'all. So we'll go back to that. But I'm going to ask all of the panelists again for anything that we talked about in that segment. If there are any questions, anything you want to answer, anything you may want to add. And I know when Dr. Primus gets back on, we'll give her the opportunity to answer the question. As soon as she got the question, then she got logged off. Sure, it might be a part of. Oh, she's back. Hey, Dr. Primus, welcome.
Hi, good evening. How are you all?
Great. I don't know if you heard the question. We introduced you and everything, but we had a question for you.
Okay, I'm so sorry. It literally
do
hit
not
the fan
apologize.
right at the time.
You're doing the work. Don't apologize. Yeah, so you were quite active and vocal in the community and on social media during the height of COVID, and you were providing factual information to all members of the community, but especially working with rural and marginalized communities. Can you tell us why and what your message is today, since some people believe we are post-COVID and shouldn't have to worry anymore? Uh-oh.
Okay.
We see you now.
Okay. So for one, it was imperative for me to get the message out to our rural folk simply because, for one, I grew up in a rural area. Two, the access to care um, somewhat is of a primary care desert in our rural areas. People don't have the same access to care in those areas. And so as a result, we have more disparities there um, in almost every disease process. When it comes to COVID at this point, people have relaxed their precautions. We have slipped into a more um, lax period where we're not as cautious as we once were. Unfortunately, the numbers are starting to creep back up. The good thing about that is the silver lining in that, I should say, is that the patients are not as sick as they once were. And that is afforded to us because of vaccination and vaccination rates. So it is important that people are vaccinated as we still see different types of variants. It's important that we're getting our booster shots in a timely fashion, and that's anywhere between 5 months, 3 to 5 months after the first dose, first series, and you're talking about two additional booster vaccines at this point. So we're not out of the woods by any stretches of the imagination. We're not seeing the volumes that we once were, but we are starting to see an uptick. And that can be attributed to people are congregating because it is the summer. And again, we have relaxed our precautions with wearing masks and even washing our hands. So we're not out of the woods yet. This is something that's still serious. We do have vaccination. We do have other treatments for it now as well. Um, those who have mild to moderate symptoms can take a pill now, and that's something that we have seen great benefit with that. So it definitely depends on the severity of symptoms, and so we're not out of the woods yet, but we are making strides in regards to treatment these days.
Thank you. So for everyone in that segment, is there anyone that has anything you'd like to add or bring voice to before we go to another set of questions, and some that I'm getting from us from different parts of our social media world? Please come in if by any means.
I think oh, okay. I was just going to say, I think that there is a lot of consistency with what all of us have been saying in terms of, being proactive. So, instead of reactive. So getting the vaccinations, being mindful of community spread, being mindful of, where you're going and what's being said. And then, unfortunately, with the resources piece, it's a little hard to be proactive, but I mean, you can be proactive in knowing what's out there and knowing what you may need, or even getting that list. But it goes again. I hate feeling like a doomsayer saying this, of just the individual nature or the family unit nature of how things, you know, have turned out, because of the way that we have chosen to handle this pandemic, let certain things become political instead of social. You know, we are not looking out for the least among us, which are, you know, those who can't get the vaccines because of, you know, just a medication reaction, or those who have are immunocompromised. You know, it's hard, and it's disheartening to see that that's where things have gone. But you know, I'm a 37-year-old relatively healthy white individual, but I still wear my mask because of thinking about the others around me, you know, and I think that is, you know, and I think that pieces and parts of that are very consistent throughout what we are all saying, you know, and that post-COVID really is, hey, you figure it out, you know, which is a struggle, you know, in that respect, because it means that we are not all on the same page, unfortunately.
Thank you. Anyone else? So, Dr. Hugie, I'm going to come to you, and then Dr. Primus, I'm going to come to you. Then I have another for everyone. Dr. Hugie, there's a widespread number of people who haven't experienced COVID as a diagnosis, but they still credit the effects of the virus as a contributing factor to their heightened anxiety or new levels of depression. Let me raise my hand. Why do you think that is?
I think that because we know much more than we knew, obviously, when the virus first came out, but there's still so much uncertainty. And it's really not an irrational fear, right? It is that people did die. You know, millions of people did die, and many of us have experienced loss due to COVID in our families. And so I think and so much, you know, for me, having given birth to my beautiful twins on April 8th, and I can remember very clearly when my husband could attend doctor's appointments with me to when he couldn't, to when they told us we couldn't have any visitors at the hospital. And then they were born April 8th, and on April 12th, when I brought them home, all of the help that we thought we were going to have, we didn't have anybody in our house. People dropped food at our doorstep because we were terrified that someone would come into our home and cause our children to get sick. And, you know, the news certainly, you know, seeing what was happening in the media as it relates to people contracting the virus, what widespread and mass loss, and, you know, hospitals being overcrowded, all of those things are very, very real, right? And so I got to the point where I honestly, just for my peace of mind and for my sanity, I had to stop watching Government McMaster's press conferences, and I had to stop looking up the numbers every single day just so I could be present and available for my family. So having personally experienced the anxiety, and not just because of a perceived threat, a real threat. And so that makes sense to me that so many people experience more anxiety because we didn't know what was going to happen. And I think now there's still that caution and people still have some sense of anxiety. But then there's this group of people now, it's just like, well, I don't even care, right? And so if I get COVID, I get COVID. So I think there's that balance between our quality of life, being able to enjoy the COVID era as we're emerging into some type of normal life. I apologize, Scott, in the background. But then not even being COVID conscious at all and not caring, right? Just kind of finding that spot where the anxiety is not so debilitating where we can't function.
Thank you. Wow, that's a lot to unpack. Dr. Primus, and then we'll have everyone, because there's a lot come from all of this. We hear a lot about healthcare disparities. Can you tell everyone what is meant by healthcare disparities in layman's terms and why one of your passions is working to eliminate them? We can't hear you, Dr. Primus. Perfect.
Can you hear me now?
Yes, ma'am.
Okay. Healthcare disparities. Unfortunately, our different populations and groups across the country suffer from higher morbidity and mortality from certain disease processes compared to other groups. And the disparity is I can go to, I as an African American female, I can become pregnant and I can have my white colleague, she can be pregnant. I am 6 times more likely to die in childbirth than she would. And there's a reason for that. Um, a number of reasons for that. And so those are even with my social economical status, I'm still more likely to suffer and have a higher morbidity and mortality rate than she would. Um, my passion is because I grew up watching my parents suffer from the same disease processes from as their white counterparts and white friends, but they didn't do as well compared to them. Part of that is because they didn't have the same access to care. Some part of that is because they didn't have the same treatment options. Other reason is because they were not treated the same when they were seen by the same physicians, same healthcare providers. So my passion is to eliminate that. Anyone of any hue should be able to walk into any hospital and any doctor's office and receive the same standard of care and have the same outcomes as a person who is purple, yellow, green, or white. There is no excuse for that. And so that is my passion. I work hard every day. And I try to educate residents when I talk to them. And I tell them to use the rule of thumb of if you treat everyone as if it's your grandmother, your grandfather, your mom, your dad, your brother, sister, then we can get to the bottom of we can start to combat the the whole phenomenon of health disparities. So if you treat everyone like you want to be treated and you treat every patient as if they're VIP, then that is when we'll start seeing a shift in our healthcare.
Wow. Thank you. So in this segment, before I add anything to, are there any comments, anything that the panelists would like to add to the questions, to the comments, to what was said, or something that may have sparked because of what was said?
I think even as it relates to health disparities, as Dr. Primus was stating, even beyond the access of care or lack thereof, or people being treated differently, I have found, at least in my clinic, there's a lot of um, people they're reluctant to receive treatment, right? I think there's the stigma of healthcare in general, and fear of medications and those kinds of things. But then I feel like mental health really has that double stigma, the stigma that it has in and of itself, but there's a lot of distrust and even education that I have to overcome as it relates to trying to talk people into taking either psychiatric medications and or even taking time off work because they're in crisis and they don't realize they're in crisis. I was on a panel more recently and talking about the mental health of Black women being a public health crisis. and really how, the screener for depression, the highest score is 27 for a PHQ-9. And so I have, women that often come into my office and, their scores are 25 and, near what we would see as it relates to putting folks in the hospital, and having to talk them into really engaging in treatment and not seeing them struggling from a mental health perspective as a weakness. And, what's often fascinating is that depression has such a high burden of disease, right? People are out of work for depression than anything else in the world, but we still see these women who are highly resilient, who are taking care of their families and their children, and who are running organizations, but they have these critical depression markers and numbers and symptoms. So that's my soapbox for the evening. I'm not even sure where I was going with that comment, other than you see disparities from both ends in terms of the lack of access to care. But then when people come into treatment, they're reluctant to engage.
And I want to, add on to that, for so long in our country, healthcare in general has really been a combative issue, because unfortunately, healthcare is a privilege, not a right, because in order to get healthcare treatment to a full degree, you have to have a job which provides you with insurance. And even, that on a base level creates this distancing effect, in addition to the fact that, there are still costs involved. So then you have such a staggering amount of medical debt into this country, in addition to the fact that up until recently, you could be denied health coverage because you were sick previously. So you can no longer be denied based on a pre-existing condition, but there are so many people who have been conditioned already to not engage with their health coverage or, put things off because of the cost involved or because, well, I got over it before I can get over it again, and that there is even with Medicaid, Medicaid fully covers individuals, for their full coverage. But so many people still have that kind of 80s welfare queen narrative, associated with it. And so, I have talked to people, well, we don't need Medicaid. We don't want Medicaid. And it's, trying to explain and educate that, Medicaid is income based. There's not a limited pool. I've had people say, well, we don't need it because somebody else could get it. And we're, taking it from somebody else. And no, there's the pool of money's there. You're not taking it from somebody else. It can be a secondary coverage if you qualify, and would then help with those additional costs. But I think that in this country we have been so distanced from it for so long, in addition to the fact that we don't actually teach people about health coverage. We don't teach people about what it is to have health insurance, what it is to have Medicaid, what copays, deductibles, all of that are. And for a lot of people, it feels like a weird shell game, and you're just waiting for, the poison pill to come up and completely, throw you. And I think that, it is so frustrating and so distancing on top of everything else, like the disparities that affect the Black community, rural health disparities where you have to go maybe even to a different county in order to get to a hospital. It is not streamlined. It's not effective. And it creates so many roadblocks for people to even engage with it on the most basic level to get their needs met. And I think that the way the pandemic has turned out, the way that it has spiraled, and the reactions, I think, are a complete symptom to our complete disengagement with health coverage. And I think, there is a lot of people that would argue, well, it's everywhere. It's in other countries with healthcare systems, and they're still struggling. Yeah, but are they struggling as much? Or is America number one leader in the death toll, which is not a great place to be as a first world country, and I think that, to dovetail then, and also to the other piece that was talked about, with the depression side of things. And I think the other big thing is that the goalposts in the beginning were constantly moved for the lockdown and what it was going to mean. And I think that has also left a lasting legacy of just, that depression and anxiety of when's it going to get bad again, or I can't disengage, or even leading to, well, you got to get COVID sometime because, it's just the way of the world now. And it kind of leads to this destructive apathy because we just don't know the long-term effects, and we don't know what it will mean. In addition to the fact that, it's going to spawn variant after variant and, just create a further entrenched systemic issue. But yeah.
I'm glad you said that. Is that there's a question that came for social media, and Gary, it goes, I guess, first to you, but it can be for anyone who may be knowledgeable. It talks about what options do people have that for Medicaid that make over the Medicaid income limit, but not enough to receive affordable ACA coverage. What are the what are the options?
I feel like I'm Mr. Good Time, great information over here today with all my doomsaying. Unfortunately, there aren't really many good options because in South Carolina, in every state, Medicaid is income-based. But in South Carolina, and you can find the Medicaid income guidelines online, but the people most likely to get Medicaid are children, followed by expectant women, followed by parents and caregivers, and then women with breast and ovarian cancer or uterine cancer. And then outside of those who qualify for, disability and get SSI in different ways like that, or have extreme health conditions that qualify them for Medicaid. For somebody like myself, who is, again, a 35-year-old man, there really isn't a category for that. South Carolina is one of the states that has yet to expand Medicaid. And what that means is that there would open up a category for an individual like myself who doesn't have kids, isn't expecting, where if I make under 100% of the federal income poverty guideline, which last I checked, and this was a couple years ago and it changes, but it's around $13,000 a year-ish, they would qualify for Medicaid, but we don't have that. And what we do have is nothing, unfortunately. We have programs, those community resources that try and help fill in the gaps, but nothing that will fully be health coverage, will not be health insurance. And, so when people are, struggling with prescription costs or struggling to actually get the full care and recovery that they need, a program like Access Health, which tries to get people the assistance they need, but can only go so far, is not going to fully cover that group. It depends on the resources that they have within their system and network. There is a great resource in South Carolina called the Palmetto Project. They are located in North Charleston, but they cover the entire state. And what they are is a nonprofit health insurance broker. And so you can see them as much as you want, doesn't cost you a thing. But they help people with Medicaid, filling out the Medicaid applications. They can advocate for people at the Medicaid office, drop off applications, follow up on the applications. They will help people with their Medicare plans. So not just saying, well, this is the plan that I rep and here's what will help you, but sit down. What prescriptions do you have? What doctors are you seeing? Help you see what's in network and help you see what covers the cost the best. They do, full insurance. They do Affordable Care Act. So they can really sit down with an individual and talk about everything and go over everything with that person and find you all of the options that may be available to you. And in terms of that kind of deep dive, that would be the best, in terms of that kind of full resource if you're not really sure. But unfortunately, as I said, because we haven't expanded Medicaid, it does leave a lot of people in what's called that donut hole, where if we expanded it, they would qualify. They would qualify in a minute. But because we haven't, it leaves a lot of people struggling for health coverage. It leaves a lot of people, in need. And, it is terribly unfortunate. But I have hope because North Carolina just expanded. So maybe soon, it'll work its way down to South Carolina.
Thank you. And I think as we go into another question, and this will be open to everybody, and it's one that we've had twice now in some way or another. I think it's important for all of us and everybody in the listening audience to remember we have certain privileges that many other people do not. And whether it's because of where we sit, what we have access to or not, and it doesn't matter our race, it doesn't matter our height, weight, socioeconomic status. And if we aren't if we're not cognizant of what everybody else goes through, it's a disservice. Just because I don't need it, it doesn't mean that somebody else doesn't. And so we've really got to think about when we're providing this information, because Gary knows, I asked him before, I'm like, I didn't even know that about Medicaid. I didn't, it's just things I didn't know. And sometimes when you don't have to know, but somebody else may. And so to be knowledgeable, or I may not know it, but I can tell you who to go to. And so everyone you have more resources now. You have people who are willing and able to help. Y'all, this is a question that's come up twice. And so I want to make sure, as it comes from Zoom, the question is this, and this is open to each of you. Should we be worried about monkeypox like COVID? My 12-year-old is worried about going back to school. Who wants to begin? Dr. Promise, would you like to begin? And then we'll go around. She looked like, hey, I'm a mute now. I'm going to mute.
We should be cautious. The route of transmission is slightly different. However, there are some studies saying that there is respiratory droplet transmission. So it's really early in the sense of should we panic? I wouldn't say that we need to panic, but I do think we need to be cautious. I think people, there are certain risk populations that had an increased risk. There are kids, of course. Kids are in close contact and proximity when they're playing with each other, at risk as well. There's treatment. There's a treatment option for it. It was not like when we were at COVID. When we were in COVID, we didn't have any tools in the beginning. We do have treatment for monkeypox. However, again, there are certain areas, mostly your urban centers, that are actually seeing it more frequently. And the world is not as big as it used to be because of travel. So we do need to be cautious, and again, washing hands, being, I would say, separating some distance between you and others, and avoiding congregated spaces, especially if people are traveling all over the place now.
Thank you. Anyone else want to address or answer or think about, explore that?
I mean, I agree with Dr. Premise of just, yes, we are not at a place to panic, but I think that we are at a place to be mindful. And I think that, you know, it does have a longer period where, you know, kids or individuals affected with it may need to be in quarantine or out of school or out of the work environment, which, you know, is hard, especially for families and kids. You know, it can go through households, and I think again it goes back to, you know, even how it is with COVID. You know, of just that kind of individual responsibility piece and that mindfulness piece of, if your kid is worried about it, is there a way to find the numbers in your area, you know, find your community if there is tracking, you know, because I don't think we need to be in a place of, you know, lockdown or anything, but I personally, you know, I am more wary of how our government is going to be responding to things like this at this time, of just even just on an infrastructure level of what is in place to help people. So again, it's not, we all need to run and hide, but I think again, just being mindful, being aware, you know, yeah.
I like to add that, and again, being mindful. The difference here is the transmissibility. I think that's something that we need to also keep in mind. With monkeypox, with COVID, you couldn't see it. You couldn't see COVID. With monkeypox, you can see the lesions. You can see if a person or coming close contact with may have some skin lesions. Of course, that's the warning sign to stay away. Um, you know, but again, like I said, there is the respiratory secretions as far as being face-to-face contact for a prolonged period of time. You know, that is a way to transmit the virus as well. But again, it's mostly a contact virus versus with COVID. So again, being mindful and understanding that no, I would not, this is not panic mode. We don't need to panic about it, but we do need to be mindful of close proximity with people. And I think people are already on alert looking for, if anybody look like they have any type of pox or lesion, then people are probably going the other direction.
Thank you. And I think that summarizes a lot, to be mindful. You know, we go back, you know, Dr. Thomas was saying that during the height of COVID, wash your hands, stay, you know, wear your mask. All, and it seemed to the point it was like so much, but how that plays into the mental health, how that plays into everything. You have a 12-year-old that is already asking and afraid to go, not afraid, but concerned about going to school. Whereas when I was 12, it was, what was I going to wear? What was my clothes? You know, how I was getting there. And now our children are concerned about, you know, contracting things. And I told someone I had a procedure yesterday, and before going on anesthesia, I remember the anesthesiologist having a probably a fever blister. But in my mind, before zoning out, I remember saying, "I hope it's not monkeypox." What did I woke up like? Where did it come from? Unconsciously, subconsciously, my last thought was about something that even 6 months ago I would not have thought about. So as we're looking at, you know, I don't see any other questions and things of that. And before you all have an opportunity to give any closing remarks or things you want, what is it that we can do to make sure we aren't adding to any misinformation or hype? Because I think for each of you, I think Dr. Hugie, in my mind, that how important mental health is. And, you know, the slogan that used to say a mind is a terrible thing to waste. And we'd be like, ha ha. No, it's serious. And it is so important to protect your mind and your peace. You know, Gary, I think about with absolute health that there's so much misinformation and things people don't know. And so because there is help, and you were one of the first people for me in my life to ever explain it in a meeting in such a way that I understood. And I'm sorry, I have 4 degrees, y'all. And if I didn't understand, and he made it so simple that I think if everybody could make it simple. Ebony, you know, being a teacher and then going and being an interventionist and now an assistant principal, so you're around thousands of children. They're coming back to school, and that's your job. So it's not like you can avoid it. So not only thinking about you, your safety, your health, that of teachers, educators, administrators, but all of those little lives, and then going back home to your family every day. And then Dr. Primus, who was apologizing as she sits in the hospital, who hasn't left work yet from this morning because of emergencies, pagers going off with her stethoscope and people walking behind her. And we're trying to get information to the people. What are some things that you either wish you would have known or could have known, or you want people to know that you think could be helpful, that sometimes we just don't ask? We don't ask because we're ashamed, embarrassed, or we don't know to ask. And you just are sitting there like some days like, dang, if they only knew. I think that's how I want to begin, you know, to think about how we close, and any way you would like to come with that. Just some helpful information to the everyday person who may stumble upon this one day in Timbuktu. What would you like to say to them?
I would say never be afraid to ask questions. Our people perish for the lack of knowledge. And a lot of that comes from being afraid, like you mentioned earlier, not feeling comfortable enough, or just being afraid to ask questions because of fear of embarrassment or fear of being seen as though you may not be intelligent. But I've always felt like no question is a dumb question, especially when it's regarding your health, and regarding the health of others. That is my take home point. I stress to my patients, if you feel like your physician or healthcare provider is talking above your head, make them stop, because you are the best advocate for yourself. And so if I make it a habit of, speaking very plainly, simple, because of course everyone does not have a medical background. And sometimes we're talking and it sounds like Greek to patients. But I make it a habit of talking really slowly and making sure there is clarity by the time I leave the room. And so my take home for people is ask the questions. Ask the questions, leave with a clear head. Thank you.
So I'll share a quick anecdote. Hopefully, Ms. Fleming doesn't yell at me. I know we're trying to be mindful of people's time, but for me, there is a personal aspect to some of this. My first daughter was born 2 months early, and we were living in New York at the time. And when she spent 6 weeks in the NICU. And when a family has a child that's in the NICU in New York for over 30 days, the family automatically gets Medicaid. I have a master's in cartooning. Take that for what it is. My wife has a master's in social work. We are both educated people. We did not know what it meant when we got Medicaid, what that meant for our family. Our daughter was $1 million from jump. She was born, she already cost $1 million. And we were waiting for those medical bills to come in. And in addition to that, because of other matters and issues, we were having to move out of New York City because we could no longer afford to live there. So we were looking to move in with one of our parents, which means neither one of us would have a job for a certain amount of time, in addition to, student loans. So we have money that's already going out the door. We only paid $250 for my wife's copay for being in the hospital for that child. And that is because my insurance covered what it covered, and for whatever else it didn't, Medicaid covered the rest. If I had known that then, that would have been a huge weight off my shoulders and for my family, because that would have been one less massive stress. And nobody at the hospital educated us. And I'm not throwing shade or anything. What I am saying is you don't know what you don't know until you don't know it. And when there are not people to help educate, when there are not people to help guide, it creates problems. And I think that for me, I have really taken that to heart in the work that I do, because not everybody knows what I know. Not everybody has had the life experiences that I have. And not everybody, because at the end of the day, when it came to the Medicaid, it didn't matter that my wife and I had a master's degree. We could have just been anybody with any level of degree. When somebody is not there to explain it and you are in a point of crisis, you cannot engage. And so things fall through the cracks. And I think that to be mindful of that when you are sharing information, when you are engaging with folks, being mindful, trying to meet them where they are at, to explain things as clearly and concisely as possible, walk them through the process, engage them. And, if you are sharing information, do some level of work, to verify that it's real. Unfortunately, we live in a world of just nonsense information, that can easily be reposted and reshared and all of that. And, I let my wife be the filter at this point. I don't share anything on Facebook or, I don't retweet because I don't know. I'm not that smart. My wife is. If she tells me it's true, I believe her. That's know your people, and I think that's, even true for how people engage with Medicaid. In South Carolina, there are 4 different Medicaid plans. How people often pick the plans, about 50% of people pick plans actively, the other 50% passively pick a plan, which means they're assigned to a plan. And the way that people usually pick the plan is they know somebody else with Medicaid, ask them what plan they have. So it's about who's in your world. Who can you trust? Who are your people? And I think trying to be the best person where you can is going to go a lot further, just in this world right now. Be that good resource for somebody. Be somebody that can be relied on. So.
Dr. Hugie or Mrs. Summers Fogel?
I would echo to not be afraid to ask questions, especially when it comes to your child and their education. You can't be afraid to speak up for them as far as their educational choices and as far as their health. The old saying goes, the squeaky wheel gets the grease. So in education, you have to speak up so that they know what your needs are so that they can help you meet your child's needs. If you think that they need to be tested for an IEP or they may need accommodations through a 504, ask those questions. And if you're not sure what questions to ask, there are advocates available that can help you formulate those questions and go into the meetings with you to talk on you and your child's behalf. So don't be afraid to be an advocate for your child and your family.
I want to echo what Dr. Primus was saying about understanding that you have a choice, as it relates to your healthcare. One of the things that I try to do when engaging with patients and they're asking questions like this is a partnership. And so, because oftentimes people are used to the paternalistic aspect of healthcare, and they'll say, well, you're the doctor. I'll give them their options, right? And they say, well, you're the doctor, so whatever you say. And I said, no, 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 it's not what I say, because I'm not the one who has to go home and take the medication. I am not the one who has to do this. So it needs to be a partnership. If it's something that you have a question about or you don't agree with and we don't address it here and now, then I've wasted my time essentially. From a mental health perspective, we always have a choice and how we respond. There's so much that's going around or going on these days that we don't feel like we have a choice, that there is so much uncertainty, but we always have a choice in how we respond and we have a choice in how we govern our lives. So that's my closing comments.
Wow. Wow. So I can't thank each of you enough. And I see that Dr. Promise maybe had to drop off with emergencies and things happening at the hospital, but just thank you. There are not enough words when we were thinking about putting all of this together and thinking about the why. It was some people who had the thought, well, we're over it. We really don't need to have a conversation. Clearly a conversation is necessary. I learned something. People are saying thank you already. I learned something. I'm hoping everyone else has. And if nothing more than the resources that are available that we will place out there. But thank you, Dr. Hugie. You are available. I have asked each of you about being able to put bios and contact information as it relates to your businesses or what you do, and we'll get that permission. Ms. Summersfogel, as the students are about to come back to school. And, just as a reference point, how many students do you have at your high school? And this is just one high school.
It's growing every day, but we have almost 2,600, and that's about 700 freshmen at my school.
Yeah, that's a lot. That's like that's a college.
We're going to pray for you.
Right. Because that's a lot. 9th through 12th. Everybody's like,
yes.
And, and Gary, to even hear that there are 4 different Medicaids, and then thinking that I always ask a general question like, oh, everything's for everybody, same thing, not even knowing that. So just thank you. Thank you for each of you always being willing to serve, to be able to serve in the community, to be able to be available for an evening, to have conversation questions and things. I will begin to close by just saying, not only for the Dorchester Parish and on behalf of the Dorchester Parish and everything else, but also the funders for programs such as this, people who don't deem it robbery to have grants so we can do things in the community. As we were thinking about doing this in person, we all agreed that it would be so much more impactful to have this virtually, where it could be recorded, it could be saved, it could be utilized for a tool. You'll be having other things come from this particular group doing things. One is going to be a COVID type and informational scavenger hunt that will be online for prizes. Look for those type of opportunities, because we want it to be informative, but we want you to have fun. At the Cops and Kids, the 8th annual Cops and Kids Back to School Bash, that will be August 27th in Lincolnville, sponsored by Taking Back Our Village. Come out, food, fun. It is about meeting the police officers and forming a relationship, having school supplies for students, book bags, but humans getting to know humans in a safe environment. We're going to ask for masks, although when we're outside, when we're in close proximity, we are going to ask. But there are so many things in the community that we want to make sure we are engaging you, because someone said it best, we need to be in community. We have lost that in some ways. And I know COVID and everything else had us isolated and separated. Let's bring it back. We're here. I'm seeing that, Dr. Hugie, in less than 6 months of opening a practice, has 800 patients. So when you think about all the things we can do So August 27th, which is a Saturday, is the back to school bash. We'll put that on the Zoom. We'll put the flyer if they go to Dorchester Parish page. If you go to Taking Back Our Village and Facebook, those are the things. There's so many things available. Please let us know if there's anything we can do to be of service. But thank you for your time. Thank you for your energy. Share this far and wide, even if it's a little clip from somebody. Share it so everybody some information. Dr. Primus, you weren't able to close or say anything. Is there anything else you'd like to add as we begin to close out for this?
Again, I apologize. Everything happened at the same time as we're supposed to get signed on, but this has been great. This has been great. I really enjoyed listening to everyone speak. It was very insightful as well for me. And anytime I may be able to assist you, I love to do so. Thank you again for having me.
Thank you for being here. Thank each of you for your time and your talents. Remember what I asked you about and for, so I know you'll be sending me that, and I'll put it in the email. But thank you all. Have a safe, wonderful Friday Eve, weekend, and lifetime, because that's what we're here to do. We're in this together, and remember that. So there's always somebody, and if you say there's nobody, then reach out to us. We are somebodies to be able to assist. So thank you all. Have a wonderful, wonderful evening.